Thank you, Shane. Hello, everyone. Thank you so much for joining our August meeting of the Maryland Commission on Public Health. I'm Mina Brewster, one of the co-chairs, and will be convening the meeting today. And sitting next to me is Tosin Olateju, the other co-chair for our Maryland Commission on Public Health, as well as Boris Lushniak, who's joining us virtually, also another co-chair for the Commission on Public Health. So we're really excited to have our meeting today. There's been quite a lot of activity that's happened over the past few months, as many of you know, and in particular, we have many updates now that we're meeting after the 30-day public comment period and have had a chance to digest and follow up on some of the comments submitted during that period. Shane Hatchett, our commission manager, who's here, will kick us off with the roll call. But before we do that, just to make sure everybody knows that this meeting is being recorded and will be posted publicly, as the recording will be posted publicly on the commission website. So if let's go ahead and call to order and have Shane go ahead and take the roll call, please.
When I call your name, please respond with here or present. Delegate Bagnall.
Here.
Camille Blake Fall. Christopher Brandt. Mina Brewster.
Here.
Jean Drummond. Senator Lamb. Here. Deputy Secretary Lord. Boris Lushniak.
Here.
Tosin Olateju.
Here.
Maura Rossman. Nicole Rochester.
Here.
Michelle Spencer.
Here.
Deputy Secretary Meg Sullivan or representative.
Hi, it's Elizabeth Crom. I'm here.
Alan Twigg.
Here.
We have a quorum.
Thank you. Appreciate that. All right. Thank you so much again for joining us, and thank you for making sure we have a quorum today. Appreciate that. So we'll have a review of the agenda for today's meeting, and I'll ask for somebody to make a motion to approve the agenda or make suggestions on it.
I'll make the motion.
Is there a second?
Second.
Thank you. Let's go ahead and all those in favor of the agenda, adopting the agenda as distributed, please say aye.
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 All right. Any nays or abstentions? Thank you. Motion is adopted. We'll move over to review of the minutes from the last meeting in July 10th meeting. Again, these minutes were distributed to the commissioners ahead of the meeting. And if there's no amendments, I'll take a motion for approval.
This is Nicole Rochester. I move to approve the minutes from the July 10th meeting.
Thank you, Nicole. Any seconds?
Tosin Olateju, second.
Thank you. All right, great. Any discussion on the minutes? All right. All those in favor, please signify by saying aye.
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 There are two online. Are there any other ayes?
Aye. Aye.
Thank you. All right. Any nays? Abstentions? All right. Motion approved and minutes adopted. Thank you. All right. Thank you. And Shane, I'll hand it over to you if you wouldn't mind, please, providing commission updates.
Sure, happy to do so. All right, as we usually do, we're going to start out just a reminder of our timeline here. So in the next few months, or excuse me, the next few weeks rather, in short order, we are going to have some drafts of the final report in front of you to start collecting feedback. And as the support staff and the co-chairs and I have been meeting, it's really kind of become apparent to us just how quickly we're approaching that October 1st deadline. So on one hand, it's exciting. On the other hand, it's a little bittersweet. I have enjoyed working with all of you, but it does also mean we've got a significant amount of effort between now and then to make sure that we hit that deadline. You'll see today a combination of, a couple of things that Sarah and I will be bringing up for discussion, and we really do want discussion and conversation, but we've covered a lot of ground in the last few weeks, and have to give a shout out to our academic partners at UMD, MSU, and Coppin State and other academic institutions that have been helping us with crafting recommendations, the assessment, and bringing all of this together in a way that really tells a great story of the work of the work groups and ultimately the commission as a whole. As a reminder, when you kind of tally up all of the number of individuals involved through the work groups and commissioners and staff, we have well over 130 people who have kind of brought their expertise and lived experience to this. And I think that's a true testament to the passion, but also the kind of diversity that we're including in this in a way that other states that have embarked on this project haven't been able to really do. So I think that's something to acknowledge and really be proud of. But with that in mind, today we're going to focus primarily on updates on where the current slate of recommendations are, and particularly as a result of the open comment period and what we heard from folks. As a result of that, we do have 6 recommendations that we'll be bringing up for vote. So there's a bit of activity for us to do there. We're also going to cover the organization of the slate. You'll notice that it's very different than kind of where we started initially back in June. So we want to make sure that we're doing due diligence and checking in with you folks to ensure that we're characterizing things correctly, that it matches the intent and the ethos there. And then finally, we're going to pick back up the conversations from July when we started talking about structure of the final report and what that could or should look like. And so we've got a pretty significant portion of today's meeting dedicated to that conversation. So hope that we'll get some good dialogue from you folks on that. Okay, before we jump into that, a couple membership updates. We do have 2 vacancies on the commission now. Some of you may recall that Dr. Levy was serving in the urban local health officer capacity and is now with Carroll County, which does not satisfy that class of commissioner. So he has resigned that position. And of course, we still have the vacancy from Fran Phillips earlier in the year when she had to step down for personal reasons. So at this point, we are at 14 members, but we have been in talks about maybe the need to have those filled for the next 6 months or so, particularly going into the legislative session, and understanding how that may help carry forward some of the work of the commission, even after the meeting phase and report drafting phase, that it might be valuable to still have a coalition of individuals representing this work. Ultimately, this is all dependent on the governor's office and where they decide on how to proceed. But wanted to update you on that, make sure that you were abreast. And then, of course, Deputy Secretary Meg Sullivan has joined MDH, taking over the public health services and public health administration role there. Dr. Sullivan is has been in contact with us, and we're working to get an introduction meeting with her. It's our understanding at the moment that we'll continue to work with Dr. Crum, who of course is on the call, as well as Vanessa, who's been one of our key contacts at MDH previously. And so until we're instructed differently, we'll keep going down that path. But just wanted to acknowledge from my seat anyways, the sigh of relief that Dr. Crum is going to continue to be engaged, and to frankly thank her for continuing to be involved in that, jumping in short order and keeping the work going on the MDH side of things. So more to come there as we learn from that. A bit of a refresher for those of you who were able to make it to the July meeting. This is a repeat slide, but I thought it was worth mentioning just to kind of level set and make sure that we all kind of had a good sense of where things were as it related to our open comments. So we ended up receiving 35 comments in total. Of those, the majority, in fact, almost all of them were substantive. And that was kind of our first cut of, is this something that we truly have to address and resolve, or is it not germane or out of scope? And so to only have 4 out of the 35, I think, is a really fantastic demonstration of the commitment that folks went to in terms of reviewing the recommendations, providing thoughtful feedback, and really spending some of their time and effort to make sure that they were heard, and that we had something that was really useful and actionable to take to our work groups and kind of work through the recommendations. Of the 35 we received, 16 indicated some type of affiliation. So that could have been with local organizations or entities like boards of health or health improvement coalitions. We had some that represented state agencies, which we had follow-up conversations with several of those. In fact, some of our most robust and thoughtful commentary came from a couple state agencies and really helped kind of shape or maybe reinterpret some of what we were intending to kind of balance the perspective there. And then we had a few that came through representing practices or professional associations and so forth. Geographically, a pretty typical spread, too concentrated in one particular place, but we did at least get kind of a broad swath of Maryland there. And as I look at those county names, a lot of them are familiar from our site visits and listening sessions. I was joking with someone recently, I feel like an honorary Marylander having gone to all 4 corners. So the update to that is, of our 35 comments, and I've got to give Sarah Bora some real credit here. She went through methodically each of those and tied the recommendation feedback, or excuse me, the feedback to a recommendation, and the correlating changes or edits that were necessary. So we ended up with 66 different edits or changes that needed to come through as a result of that. So I'm not sure how she didn't go cross-eyed doing all of this, but it really was a great tool to then share with our work group co-chairs. It allowed us to start to work through some track changes and I don't want to say negotiating, but brainstorming and figuring out what's the right balance to hit here so that we're being true to what the legislation contemplates and what the work groups and academic partners discovered through their assessment findings, and still addressing that need and making sure that we're moving forward there. So by and large, most of that has been incorporated into the draft slate that is currently posted, and that's version 11.5. We started out with version 1.0 in June, so that tells you how many iterations of this we've been working on with our work groups and partners across the academic and local health systems. So really appreciated having those conversations and making sure that we were still really, in tune with what the work groups wanted to achieve, but understanding that, we had to take into consideration that public feedback portion. And as a reminder, those substantive comments have to be addressed and included in the final report. So in the appendix, we will have a listing of synoptically, what feedback we received and how the commission responded to that. So we've got a really great traceability matrix here to show that, people gave us feedback. We discerned what we should do with it, and we're really thoughtful about that. And then ultimately, here's where it went. All of that, as we currently have it, is posted on the website under our public outreach page. So where folks were going to submit comments originally, if they go there now, they will see kind of that output and where we are, which I think is really fantastic for the folks who have rightfully asked throughout this process. So how do we circle back and let people know what we did with the information that they gave us? This is one of the ways that we're doing that, by showing that traceability and giving them kind of the crosswalk across the entire process here, so that it should not feel like it was a black box, or that people sent thoughtful comment in and not sure what happened to it. That said, we weren't trying to necessarily get down to one-to-one matching, but enough that people could see their voices included in that, and that it was addressed. So I think that is the last I have on comments. Yep. Any questions about comments and what we've done there so far?
I'll just step in and again, really commend our whole support team, Shane, you, Sarah, Dushanka, who I don't believe is joining us today, and Michelle and others who were a part of this process. It was an extraordinarily thorough review of the public comments submitted, as well as follow-up with some of the key organizations and agencies who submitted those comments. So I really appreciate that. I think it's put us in a much better position to describe the needs of Maryland and to make suggestions for how we address those needs. So really very much appreciate your leadership in that.
Team effort for sure. All right. So shifting gears.
Sorry. This is Nicole Rochester. My hand is up. I just wanted to quickly echo what Mina said. Having been involved in other processes in other organizations, I've never seen this degree of vigor with regard and the transparency and just the quickness with which we have been able to, or you all have been able to get back to the public. So I just want to really commend everyone who was involved in that process. I think it speaks volumes, and I think that it's going to really continue to build and grow on public trust.
Yeah, thank you for that. I don't have as many screens in front of me, so I can't see the hands raised. Anyone else?
Yeah, I would say, this is Jean, I would say I echo that, especially at a time when transparency is not always the top priority.
Thank you, Jean.
Thank you. Thanks for joining us, Jean. Thank you.
Right. So switching gears a little bit, Sarah and I are going to tag team this. And I'm going to let Sarah talk about the final report, which is something that she's really been focused on lately, and kind of leading that with our technical writer, as well as our graphics group that the BBC Foundation has brought on board to help get this going. So kind of excited to hear about the final report and a little bit about the briefs. Sarah, if you want to take it away.
Yeah, absolutely. Thank you very much, Shane. And thank you everybody for your positive comments. It's very much appreciated by all of us on the support team. we are, as Shane and Mina have both said, we are getting close to the end here. We have a very real end date of October 1st where we need to have this report published. Uh, Following this meeting, we are aiming to get uh, to all of you as commissioners a semifinal draft, so you can see the general structure of what we're trying to do with this final report. We have a lot of the content, but you will also see that there are still several areas where there is not content. As well as there are several things that have not been updated. I will mention that we are working with a separate design team. So the overall look and formatting and design of the report is definitely going to look very different. All the images that you see are mostly placeholders at this point. They are still being updated. So they are to give you an idea of what content would be there, but know that they are not in their final form. But we are very much would like to hear your initial reactions and thoughts, and want to make sure that the direction that we are going in and the way that we are conveying the work and the goals of the commission reflect all of you as the commissioners. So that will be coming to you very soon. Uh, then the big final um, and the big meeting to look forward to is September 11th. We'll be reviewing feedback, and then we're going to be looking at really having that final draft, which will we will aim to have more of that formatting, getting in all the edits and feedback that you have. You'll have a final review there from the 17th to 24th, with a vote to adopt on the 25th. So that vote is on the 25th because that way it would still allow us to do any final edits that may arise during that conversation. So we didn't want to have it too close to the October 1st date. But all that where once again to speak of transparency, want to be as transparent as that as you can all see different phases of the report, to make sure that we are able to get in any of your edits, and definitely at this point as well, we'll be talking about more, but looking into especially thinking about the way that we are representing the recommendations and the way that those are being conveyed to have the most impact.
Great, thank you, Sarah. So just as a reminder, in case you didn't pick up on this from the timeline slide at the beginning, October 1st is the milestone for submitting the report to the General Assembly and the governor, as well as other key stakeholders. But the commission does not sunset until June 2026, based on the most recent legislative update to our enabling statute. So the work of the commission can continue beyond that in terms of helping educate and bring awareness to this. And so we have begun thinking about what that could look like, and what sort of toolkits we might be able to pull together. We've also been working closely with MACHO to kind of bring them into the fold and help transfer some of the knowledge and expertise that we've accumulated on the project side of it to them, so that they can kind of bring to bear the local resources that they have here. But it doesn't really stop there, and we'll have more conversation about this because it is going to take bringing together these trade associations, professional fields, and representatives, and so forth. So it's going to be a long road between now and June 2026. So the thing that we're managing to right now is October 1st deadline for the final report, but the commission does go on. I want to make sure folks remember that. Sarah, did you want to talk about the briefs at all? I know we don't have it on the slide here, but I thought it might be helpful for folks to hear about that too.
Yeah, absolutely. Thank you, Shane, for bringing that up. Sorry. Sorry, I thought I heard someone trying to speak. In addition to the final report, we are working on several briefs. So the final report, of course, is going to be pretty lengthy, around 100 pages or so. So we recognize that that is very important, but that it will also be helpful to have some more succinct materials to share. So we are in the development phase of a few briefs that will focus on key areas from the commission, and as well as trying to make them something that is relevant to key stakeholders, so that that will be available as a resource to promote the work of the commission and the all in the messages of the final report in a much quicker fashion, for because we recognize that not everybody is going to be immediately interested in reading a full 100-page report. So we wanted to make sure that we also had other resources available. So that we are excited to have that as well. And that will be coming from a lot of the materials of the final report, but will be fine-tuned and hopefully very engaging. So we are in the process of that as well.
Thank you, Sarah. Before I jump into some of the structure and content of the final report, any questions about these dates or timelines or the briefs themselves?
Could you just comment a little bit more on the dissent process to make sure we've covered it? Okay, no problem. Go for it.
But I like it.
Yeah, no worries, no worries. Go for it.
Other than what Mina brought up. And for those of you who are wondering, okay, what's the process look like for how we'll adopt the report and so forth? I'm going to cover that here in a bit. So that's what Mina and I were having a sidebar about just now. Any other questions? Okay. All right. So again, with regards to the slate and what we shared with you, particularly in version 11.5 that went out, I wanted to make sure that folks recalled we had a, during the recommendation development process, a proposal to ask the work groups to bring in recommendations as discrete activities, things that naturally aligned with what the assessment findings indicated, whether that was work group assessment activities or our academic partners in their assessment report. And so we really didn't have a lot of guardrails or requirements around the recommendation development process. And so we knew it was going to be a little organic and have some variation there. And that's perfectly fine. So one of the ways that we tried to create a bit of structure and ability to bring those together, and we talked about this earlier this year, is adding these strategic objectives to group and categorize them to help bring together a cogent narrative around what it is we're trying to do. So that those two pieces aren't really new, except that we started to apply that in interim versions of the slate. And so you shouldn't, I hope you don't feel too surprised by seeing that, except that maybe some of the language might be new to you. And of course, all of that is up for discussion and refinement. View all of these things as suggestions from support staff and work group co-chairs. Ultimately, this has to be representative of the commission and its interest and the work there. So, no sacred cows here. We can certainly talk about any of the language there. The thing that is new, and I want to highlight so we're not caught off guard, are the distillation of the strategic objectives into themes. As we looked at those, and again, giving credit where it's due, our academic partners across the institutions gave us some really good, thoughtful feedback on how these strategic objectives and recommendations came together based on what they saw from the findings and what they heard from commission meetings to help us really distill down 4 or 5 key don't want to say problem areas, but focus areas that, we've heard consistently throughout our site visits, our work group meetings, our commission conversations, our guest speakers. And so as you look through that, particularly the second page of the draft slate, you should really kind of see some familiar language at that level. And so we'll go into that a little bit, but I just wanted to highlight this here and make sure that, no one was surprised by this or felt like, things were being thrown into a blender and you're not sure where the recommendations ultimately ended up. So our 5 themes that we are proposing are on the screen here. And as we think about the themes, we ended up with something like, I think it was like 50 or 60 recommendations. And that's a lot, right? When you're going around talking to someone and trying to convince them why they should care about this report, and you have 60 recommendations to rattle off, that's not an elevator pitch. So the themes in so many ways are something that you can use as a fantastic communication tool, a succinct way to communicate where we've focused the effort and where we see not only the problems, but the solutions to move public health forward. And again, just to put a plug in here for some of the conversations we've heard recently, I know public health, it feels like we're in dire straits at the moment and that the world is falling down around us. But, the reality is, much as John Arbach reminded us, there is a future here and we should absolutely be aspirational about what we're proposing. And I want to give Sarah Bora credit for this phrase. We shouldn't bet against ourselves in what we're proposing. And so this really could be a fantastic tool for us to, through the final report, have a kind of blueprint for how to rebuild or regain anything that we've perceived as stagnating or that we've lost along the way. So that said, these themes kind of encapsulate that in a pretty succinct way. And so we're talking about strengthening public health infrastructure, modernizing and maximizing communication, data, and IT tools, leveraging and formalizing partnerships, create bridges between public health and healthcare service delivery, and lastly, pave the way for current and future public health leaders. And so I'm guessing for most of you that, those themes and kind of language are in alignment with what you've heard and experienced in public health recently and through these conversations. But wanted to take a moment here to kind of pause and make sure that you are feeling, that this is in the right direction or kind of any early reactions you have to this.
Hi, this is Nicole Rochester again. I did, and I'm going to defer, of course, to Tony and Sylvette, the co-chairs for communication and public engagement, but I did have some concern about putting communication in with data and information technology and felt like there's a lot of the recommendations in the from the communication and public engagement work group aren't really related to data and IT, and just kind of worried about blending all of those together.
Thank you. I wonder, because I paused also when I read that the first time around, but I believe if we keep drilling down and you look at some of the strategic objectives underneath that theme, it's really more about the tools, right? And that there's an opportunity to modernize the tools that public health utilizes. And those tools apply, there's tools in the communications realm, there's tools in the data realm, there's tools in the information technology realm, and some of those cross over, for example, communications and social media and AI and so forth. So I'm wondering if the intent of this is really about the tools, then maybe moving that word up earlier might alleviate some of the concern. I don't think my understanding is that the objectives, the recommendations from the communications and public engagement work group are spread across these 5 themes, right? So there's not one work group that all of their recommendations are kind of encapsulated in just one theme. I think the intent of the themes was to be more cross-sectional and so forth. So, but I don't know, correct me if I'm wrong, but my understanding was the focus of number 2 was more on the tools. So maybe we just need to move where that word tools is.
Yeah. Thank you, Dr. Rochester, for bringing that up. And when you say that, I kind of see that and wince a little bit and think, oh gosh, that's definitely not the intent. So I appreciate that perspective. And Mina, you're right on target there. These themes are attempt to kind of break down some of the silos between the work groups to recognize that these recommendations and strategic objectives really are more cross-cutting than just workforce or funding, and that even when we try to apply things like the foundational public health capabilities as promoted by FAB, that it still wasn't as interrelated as we were looking for. And so that's why we have these really organic themes that emerge from the recommendations and strategic objectives, but that's not to say that there isn't still some need for refinement there. So this is helpful for us to hear.
Just to follow up on that, Nicole, do you think your concern would be alleviated if this was rephrased and again, focusing on the tools part, so the modernize and maximize, or something like modernize the tools that public health utilizes, including those addressing communications data and technology?
I actually, and thank you for that. Your explanation and Shane's follow-up was extremely helpful, and revising it the way you suggested would make it more longer. And I know that brevity is important. So I mean, now with that context, when I reread it, I totally see exactly what the two of you are saying. So I appreciate the input, the feedback.
Thank you.
Yeah. Oh,
Go ahead, please. Go ahead, Jean, from the room.
No, so hi y'all. Good. Thank you. So I agree with what she said. I had something I was going to say, but around the data piece, because I just think that data driven. I mean, the data analytics, and part of me is it's not just the data; it's the insights from the data, right? And part of it, we just look at the number. No. We need to look at what is the wisdom that we are drawing from that. And so I just think data is just such a compelling, and especially in an environment where, okay, do we have, what are we getting from CDC? I mean, just kind of thinking about that I don't have the answer for it, but the word data and maybe even data insights, because just data seems, we're done with the data. We need data insights. What is that sharing with us? That's one. Shane, back to your comment about the terminology. I just got off of a call with a pretty large right organization. And I joined the call because I wanted to hear the language. Our mission is clear, vulnerable populations, health equity, but I kind of wanted to hear, all right, if you know where the money is, what is the ticket to open up those dollars? And so my question to us here is, the target audience, and I know we've talked about this in the past, but as we're writing this report, all of these things require money. We've got this administration that's at least for the next 3 peace years. Are we trying to tweak it a little bit? Are we still just going hard out, racial and ethnic, populations? Are we going, health equity all out? Or are we tweaking it a little bit? Today, I learned that the new word for social determinants, or thinking in that vein, is upstream. I wrote it down. And we talked about going upstream, but it's upstream.
Drivers.
Upstream drivers of health, I think is the word. Yeah, okay. And we should, so that's one. There was about 4 or 5 little nuggets, and I was like, oh, okay, that's what you want me to say. As long as I know I'm getting food to people, I'll use the word, right? And that actually occurs, And so just thoughtful of, as a group, are we gonna stay with what we all know is like strong in our heart? May not get any funding. And I know this is falling on soft ears, it's Maryland. Or are we willing to, I don't know, so that's just, I don't have the answer to it yet, but I just got this call and I'm like, okay, Gene, you gotta think, keep, how do we do this thing? So, still stuff.
That's a great question. And it's one that we've, amongst the support staff and even to the co-chairs, had some dialogue about, okay, here's where the national winds are kind of blowing, but what's the Maryland story? And, admittedly, most of the support staff are not from Maryland, so it's kind of hard to kind of give that authentic experience. But where we've kind of landed, and this is all subject to, where the commission wants to take this, right?
Sure.
You have the power to say, we want the report to use this language and we want this kind of narrative. But giving, just kind of a reminder of where we've been, earlier this year, we adopted value statements that did include health equity. The state does have a health equity commission that is key and integral to the Maryland payment model, formerly known as the HEAD. And it does seem to be a significant priority for the Maryland administration.
It is.
So, from our perspective, it's, what's the most
best way to
authentic way that folks are going to support and fall behind. But on the other hand, we know that, it's not a great time for public health and you got to be careful about some of the characterization. So I'm not trying to persuade you one way or the other.
I get it.
It out there.
It's tough. So we know ahead is coming from CMS. We know the challenges that are with it. Right? So I would almost go to our, political representations and ask, like, because if we're trying to get, at the end of the day, public health needs money. I think we all raise our hand on that, right? And we did this, and we know this isn't gonna happen unless we have some money. I think one of the good things about the council is we had paid staff, right, to do this work. I don't know.
Because of CDC Foundation.
Right. But because I've been on. No. And I mean, certainly they should be paid much more than they were, but money, it was a volunteer, right? We've all been on the volunteer places where, things don't. And so I just ask these are wonderful. I love all of them. Now, if I look at Pave the Way to current and future public health, in my mind, I'm going to the HBCUs and thinking we need to get more people that are culturally competent, so I've got to have equity view on it, but I don't have the money to fund it. So, you know what I'm saying? I mean, ultimately, what is that goal? If we want some dollars, I think that there is a way that we can stay true Maryland. And Maryland is that, we love it, but also thinking about, we may have to pivot a bit differently than we did when we started, because the funding streams are different. And those that may still have a mindset of Maryland, they also too have had to pivot a bit.
Sure.
We don't have to go all the way, but some of the language.
Right. I think what you bring up is an excellent topic for discussion. I think we definitely need to go kind of round robin and get some input. Since you raised it, I do want to give Senator Lamb and Delegate Bagnall, if they had any comments to provide now, please do. And then if you're okay with it, sure. I'd love to table this and bring this up during our roundtable discussion. I think this would be an excellent way to kick that discussion off and gather some insight and give an opportunity for every commissioner to comment.
So just some initial thoughts. So the budget's always a challenge with the state, particularly these days, given that we're trying to backfill losses from the federal government and whatnot. I think for the commission, I think one approach is to really just kind of, put forward the best foot that you have when it comes to these recommendations that are, while aware of the budgetary issues, a little bit more budget agnostic, because the budget's always going to be a challenge. It can vary year by year. And what you're trying to create is a blueprint moving forward that's a little bit more, kind of longer term looking, has a little bit more longevity to it. And, I guess in a way, leave the budget to the budget folks to try to figure out how to plug these holes, how to find the funding to be able to do what our priorities here. But, I think maybe a little bit more context of what you might prioritize in a limited budget, and then let the budget folks try to figure out how to, meet those needs.
Mm-hmm. Thank you. Thank you. Appreciate that. Delegate Bagnall, if you had any comments, feel free to speak up.
Sure, I would echo my colleague's sentiments. I think earlier in the meeting we said we don't want to bet against ourselves as to what we can actually accomplish. But I think, and I know that we're all sort of reconciling with what do we need to do in terms of changing language and ensuring that we're using the correct language for the resources that are available. I think this commission can be a bit agnostic on that, because the recommendations are not the policy, right? So we're still going to have policy language for implementation. And I think, as this our understanding evolves, I think we will be able to pivot as needed if there needs to be adjustments in the language. So I think the recommendations, based on our best our best and most accurate and up-to-date understanding of public health, are our best foot moving forward too.
Appreciate that. Thank you. Thank you very much to you both for those comments. I'm going to ask all the commissioners joining us today, if you don't mind simmering on this topic that Jean has raised, a really important topic for discussion. I think it would be really helpful also to provide some input to this conversation so that our support team can then digest it and move forward with that guidance. So I'm going to ask you all to just kind of simmer on this a bit, get some thoughts together, and we'll do a round robin where I call on each of you to provide some thoughts. And if you have any thoughts to share on this topic at that time, I'd love to hear those. Thank you. So I'm going to actually hand it back over to Shane, and he's going to complete the commission updates.
All right. Thank you for that feedback. Very, very helpful. Now this eye chart is the strategic objectives. So you'll see that taking the 60 some recommendations that we had, we've distilled them down into about 25 strategic objectives that really help bring together those recommendations in a way that provides some kind of directional or output-oriented activity that taken together really help provide some significant change as a result of the work of the work groups and our assessment. So all of this is in the slate that was provided to you, but I just, for the purposes of this meeting and getting it into the record, wanted to put it on the screen here. And so, back to that earlier conversation about, feeling like maybe one work group was put into a particular theme too heavily. You'll see that a lot of these strategic objectives kind of cover the gamut and are distributed throughout the themes. So I think you'll find that it helps provide a bit more context and clarity about the intent behind some of that. So won't spend much time here except to say, again, these are also up for discussion. If you feel like we've not hit the mark, or it's not quite the tone or tenor you're looking for, we'd love to hear suggestions on ways to improve that. Or if you think that there's something missing and we need to kind of restructure this a bit, we're happy to have that conversation too. Okay, so coming to the final report and that last couple meetings that we're going to have here, the statute requires us to use a consensus model to adopt the final report. In fact, specifically, it says the commission will use its best efforts to achieve consensus. We've had, I think, really great conversation and dialogue so far on adopting recommendations and understanding where people are coming from. So I feel like on one hand, we've got a good history of kind of working together and figuring out how to smooth those edges. But the legislation does provide a bit of a way that, if consensus in the whole can't be reached, that we are able to file the report with some comments, or it calls it a dissenting comment. I feel like dissent is a little judicial and negative at this moment, so I'm going to call it with comments or conditions, but that would be part of the final report as well. So there is that option. The way that we're kind of looking at actions that could be taken, and again, this is a proposed framework that we're talking about here, so it's not set in stone. I'd love to hear feedback from folks, but that if you're 100% behind the final report in sum and substance, and the recommendations are right where you think they should be, and we need to take a vote to adopt it, that certainly could be one option. If you're, for some reason, not sure that you could do that, but you don't want to necessarily say that you dissent, I think abstention is an option. It feels a little less, sorry, there we go. A little less, as calling out particular recommendations or concerns in that way. But then there's also that, do adopt it, but we've got some comments or things that we want to note, and then just outright dissent based on kind of the language of the statute. That's how we're proposing to approach that. So as Sarah noted in the timeline, after today, we're going to send you a very rough draft of the final report. It has some pretty significant gaps on content, but this is to give you a sense of the structure and where this will be going, and for you to kind of start providing early feedback about what may need to be included, or maybe where you think we shouldn't spend so much time on this particular topic. We want to hear that from you. Closer to September 11th is when we will be getting you a much more comprehensive version, so that you can really start to think through what will it take for me to get behind this report and say, I do want to adopt it, or I think that this makes the most sense for the commission. And then certainly if there are things from there that seem intractable, or we're not able to kind of get it to a place of comfort, we have that dissent process, or adopting it with comments or conditions. So wanted to open that up now for kind of reactions or feedback, and certainly, I know this has been something that's been on your mind for a bit as we talked about the framework and the structure. So
I guess I just want to clarify, because maybe I'm not understanding. Are these actions related to the adoption of the final recommendations, or are these actions related to adoption of the report?
The report.
Okay, so at that point in time, the recommendations have already been adopted by the commission and will be included in the report, and then the report needs to then be adopted in order to be submitted to the General Assembly and Governor's Office.
So I guess that's actually a great conversation to have, or question to bring up is, do we want to go through and re-adjudicate each recommendation, or do we want to adopt them, taking that slate with the feedback from the public comments, and simultaneously adopting both, which would certainly streamline things and perhaps make it less challenging to kind of manage versions and for folks to know what they're voting on. But I also don't want people to feel like we're forcing a particular.
I feel like please, any commissioners interested online in saying comments, please just raise your hand so we know you're in the queue. And then, of course, anybody in the room, commissioner, please speak up. I think my immediate thought on that is that we went through a pretty exhaustive and long process, considering every individual recommendation and debating the pros and cons and the rationale and the merit and hearing from the work group co-chairs. Most of the edits that have happened to some of those recommendations are, while substantive, they're not necessarily changing the character of the recommendation, but perhaps enhancing the character of the recommendations with stronger information. And then there's also accompanying narrative to that recommendation that will include some of the context that we've gathered since the public comment period and in meeting with different organizations who provided commentary as well. So I would recommend, bless you, I would recommend if the commission is willing to consider that we adopt the updated recommendations on perhaps a category level, right? Like these are the workforce ones, these are the cross-cutting, these are the community and public engagement, communications, public, et cetera, or if you would rather, you have them, right? You have the updated language, or you will be getting those. I think the commissioners have already received a draft of the proposed updated language. At the next meeting on September 11th, after you've had at least a couple weeks to sit on and review and deliberate upon all of those, an even faster way would be to say, we can just go ahead and adopt all of them if nobody has any suggested amendments or changes that they've thought of in the 2 to 3 weeks they've been sitting on the recommendations. So either I would recommend going with one of those processes or something similar rather than going through every single recommendation individually in the interest of time. And we all have those recommendations, so we have plenty of time to review them ahead of the meetings.
The only thing I would add to that, or maybe just bring up for awareness, is the way that they've been presented is not by work groups. That would be the one divergence from how we did it previously.
Maybe it might be.
Yeah,
Okay.
right. But I think we could still accomplish some things.
Yeah, I would just think some way to kind of break it up into smaller groups if necessary. But does anybody have any thoughts on this? Any of the commissioners online or here in the room? Do you have any additional thoughts or a different way to approach? Are you
No,
sharing?
I like the direction that things are going right now. Yeah. Can we first, get the draft onto the hands of the commissioners so they can review?
Okay. How about any of the commissioners online? Any thoughts on how we go about adopting the final recommendations, the final language of the proposed? Do you mind removing that? Just so people can see. Thank you. The final proposed or updated recommendations, I should say, that have been updated since all the activity during the public comment period or after the public comment period. Alan, I saw you go off mute, but I don't know if you were trying to talk.
Yeah, I was trying to find my hand to raise, so I think the recommendation, or at least the suggestion, that we look at them group by theme, may allow for, any discussion, and adoption, that way.
Thank you. Any other thoughts from commissioners online?
This is Boris. I agree with that approach. I think, again, I appreciate this option for our commissioners, to have, frankly, multiple options, right, regarding this. At the end, we obviously want to make sure every voice is heard, and that's probably the best way of doing it. Thank you.
And Shane, just to double check this, the adoption is not happening on September 11th, right?
The final report adoption would be the 25th.
25th, okay.
But the what I'm hearing from the recommendations slate would be the next meeting on the 11th.
Okay.
So that way it gives a chance for for
It's not
everything to be
10%.
written into the actual
Okay.
report, and we can just approve the report, or get to a place of approving or provide final guidance on the report, I should say,
Makes sense.
for it and its approval. So in that context, right, in the context of making a decision on the final recommendations, which hopefully we can complete on September 11th, right? I would suggest that we have an adopt, abstain, dissent option, because then it's about the recommendation on the 11th. Okay. And if somebody is so inclined to provide a dissenting comment on a particular recommendation or group of recommendations or however, then they have an opportunity then to formally submit that in writing so it can be included as we need to per the authorizing statute in the final report. That would be my recommendation, because I feel like if we give these four options, there's some, overlap, and I don't know that we'll get to having enough people in one category to take on that category, I guess.
This is too simple. I agree with that recommendation. Makes it streamlined.
Now, for the final report, we need a final report to submit to the legislature and the governor's office. And we are, painstakingly going through a process to give opportunity to the commissioners to provide input and feedback and review, et cetera, over many weeks. And I feel like the time being invested in that process is in order to get to a place of being able to have consensus adoption of the final report. So I don't feel like at the final report adoption, we need a do adopt with comments conditions, because at that point, it's going to be really difficult to include comments conditions after the meeting on the 25th when the report's due on the 1st. And again, commissioners have had an opportunity to submit dissenting comments ahead of that date. So I would recommend we just do an adoption vote. So you either adopt or you don't adopt the final report. And hopefully we will have the majority adopt, because we are required by statute to submit this report on the 1st.
If not, they get to write it.
In 5 days, right? But again, at that point, people have provided their dissenting opinions, and if they have dissenting comments, and if they have a dissenting comment, it gets included in the final report.
Yeah, I like that breakup of the processes. I think from a management perspective, it gives us a lot more time. We were trying to balance, make sure we weren't putting too much emphasis too early, and recognize that folks kind of like to see things all together. But if we're focusing it more on the recommendations piece, then I think that helps kind of stair step it in a way that helps people get comfortable, and we can talk through things and get to a place of being able to move those processes through. So I like that.
And go ahead.
Can I ask you, when you say that you would include that in, how does a dissent?
So if a commissioner is not in agreement, and their disagreement is significant enough that they wish for their dissenting comment on that recommendation to be included in a final report that's submitted to the legislature and the governor, then we would collect that comment and include it in the final report. And
just as
wherever
as Dean Drummond does not agree.
Right.
Okay.
Right. That would be, we're not reporting out how many votes yay or nay on each recommendation. I mean, that's included in the content of these meetings. If people are interested in that, they can look at the public meetings. But we are including if somebody takes the time to provide a dissenting comment, they obviously feel strongly about it, and we want to give the opportunity to include that dissenting comment. All right, so we can move forward. For the commissioners in the room, any additional thoughts on this process of moving to adoption of the final recommendations and the final report, as well as honoring the opportunity for a commissioner to provide a dissenting comment? Okay, hearing none, I'll move to the commissioners online. For the commissioners online, are there any other additional comments or thoughts on all of that? Okay. All right. Well, thank you. Thank you. Thank you. I know, this is very logistics and operations, but again, in the spirit of what this commission has been, which has been very inclusive and transparent, we want to make sure we are in agreement in the process that we're utilizing to get to the recommendations. Thank you. All right, let's move and back to Shane and Sarah or whoever is continue to present.
Okay, so at this point, we do have 6 new recommendations to bring forward. And again, these are based on public comments and conversations that we've had with folks as a result of the public comments. So we're not going to do the online system. We're going to do old-fashioned roll call today, so bear with us. But it was just easier to do it this way instead of trying to do it for just 6 recommendations. We'll have a chance for conversation and discussion on those, but I think what you'll see is that they really do make sense once you kind of get some of the context here, but don't want to shortchange the conversation for sure. So with that, a brief reminder, I copy pasted the slide from before, so it should look pretty similar. Advanced to slate, so that's putting it on our draft slate. Cannot support or abstain. Recall, we're not at a place where we can send something back to the work groups, so that's why it's just these 3 options, and that's what we'll call when we go to do the roll call.
Sorry, Shane, to clarify, because these are new recommendations and we have our September 11th meeting to consider the proposed updated recommendations. Will these be considered also at September 11th as its own, or are we, this is the final vote on these new proposed recommendations?
Well, I guess that's a good question. I haven't considered that. What would the commission like?
Any thoughts?
I think this should be the final. That way it's easier to take the old slate at the September meeting and then proceed to the, yeah, exactly.
Yes. All right, so we have a motion for the vote on the new recommendations to be considered the final vote on these new recommendations for inclusion with whatever amendments we suggest in the final report. Let's move over to, if there's a second, we'll move to a discussion and vote.
And just to add to that, they will be put under each of the work groups.
Okay, so Jean provided a second, and Tosin further clarified that these cross-cutting, public comment period recommendations would get grouped similarly to the other recommendations that we've already developed, which are grouped according to the themes that Shane presented already.
And they are included in version 11.5, so you can see where we would place them as though they had been passed, but they are identified as new, so we can pull them out easily if they don't make it for today.
Great, thank you. All right, so we have a first and a second. Any discussion, any further discussion online from the commissioners? Okay. All right, hearing nobody jump up and speak, let's go ahead and move to vote. So again, this is to consider these the discussion, voting, amendment process on these proposed new 6 recommendations as the final vote on adopting these new recommendations for the final report. All right. For those commissioners in the room, we're just voting on the process. We're not voting on the 6 recommendations just yet. Let me just clarify. We will get to each of the recommendations. We are solely voting on the process. For those in the room in agreement with that process who are commissioners, please say aye. I'm an aye. And then online, if you are in agreement with the process, I see Delegate Bagnall with her hand up. Alan, Michelle, sorry, I can't see all of you, Boris. You can't vote twice, Boris. I can't see the others, so if I haven't called your name yet, if you could voice your vote, or I think Shane's monitoring. Nicole?
Yeah. So it carries.
Okay, it carries. Thank you. Appreciate that. Okay, so now that we voted on the process, we will now move to the actual proposed new recommendations.
All right. Just like last time. So first recommendation is PCP 066 MHO partnership. This would fall under the strategic objective of utilize umbrella organizations and add a recommendation to utilize MHO as the collective voice for all 24 local health departments, the liaison between local health officers as a group and the Maryland Department of Health, and the convener and collaborator to help achieve shared MDH, LHD shared goals, strengthen the public health workforce, and promote and advocate for public health messages. Recognize and strengthen the role of MHO in working with MDH and LHDs to streamline workflows, processes, and contract procedures, and develop supportive policies. Establish clear guidelines and practices for forums, such as creating a public health policy roundtable or enhancing the public health roundtable. Any discussion? Don't see any hands
We'll
up.
start with commissioners online. If you have any thoughts you want to contribute to this, or either support, questions, amendments, whatever, if you wouldn't mind, please raising your hand on the screen, or just talking if you can't find the hand.
Hi, it's Nicole. Could someone succinctly summarize how this recommend, how do I want to word this? How is this not, what in this recommendation is different, or how MHO is currently functioning? I just want to understand the difference between what's being proposed and the current state.
Happy to take an effort at that. So MHO is a membership association representing the Maryland Association of County Health Officers, and per the Maryland Constitution, Baltimore City is kind of under the structure, or considered as a county when we think about structure. And so the Baltimore City Health Commissioner is also included in the 24 local health departments or local health officers. And MHO currently convenes regularly so that there is, in order to identify cross-cutting areas of public health concern or operational concerns, or to promote collaboration across local health departments, and then also to liaison on behalf of the local health officers with state agencies and other statewide organizations. So state agencies like MDH, but also MDE, and also other kind of statewide organizations that the local health officers and the local health departments need to work with regularly. So that process is happening. I think some of what came out in the public comments is a suggestion to strengthen that capacity, that really MHO needs to be able to more significantly take on the role of convener and collaborator, and probably has a as a non-governmental entity has a role or has an ability to really work on some areas of innovation and special need. And one of those needs that was mentioned in the comments was the really working on strengthening the local public health workforce in Maryland, and creating more pipelines into the public health workforce for Maryland. And also MHO itself is invited quite a bit to provide local informed opinions to the General Assembly as they're deliberating on health-related or public health-related bills or bills that may have a public health impact. And it also serves as a major liaison to county officials across the state who also serve as local boards of health. So there's, I think the idea of this came from several comments that were suggesting that MHO strengthen its role in the state and have the recognition of its role or recognize that it has a significant role in some of these matters here that are outlined in this recommendation. Hopefully that answered your question.
Yes, thank you, Mina. That was very helpful. I think the remaining question I have is putting language that says recognize and strengthen. Like, how do we would this recommendation in and of itself provide guidance on how to operationalize that? Because it just seems a little big, like recognize and strengthen the role. Like, what needs to happen to operationalize that goal?
Yes, that's a great point. And I know Delegate Bagnall had her hand up, so I'll let her speak. And if there's others who want to make comments, please feel free. I think part of what we're hoping to do with the narrative surrounding each of these recommendations are to make more specific how to operationalize type of recommendations, but keeping in mind that we don't want this to become an operational document that really all the invested partners hopefully we'll take these recommendations and translate them to specific operational steps. If that's, I'm not trying to, divert from your intent there. I agree with you that specifics are very meaningful and helpful. I think it's important for us to include specifics in the narrative as we're able to, but then also leave room for the involved partners to apply their expertise in developing an operational plan as well. But let me step aside and pass it back to Delegate Bagnall.
Thank you very much. And thank you, Dr. Rochester. I think we often share a brain because I was thinking along the same lines, and I do appreciate like not it sounds like this is an attempt to get more of a formalization of what that relationship looks like. And I'm loath to use the word formalize in the recommendations document only because that may be subject to change. But I think the way that it's operating right now is that depending on, the administration and the needs of the legislature, the needs of the department, MHO is sometimes a stakeholder, is sometimes an advocate, is sometimes, expertise. And I think having a better understanding of their role in the work of the local health departments, the Maryland State Health Department, and also the legislature, I think would help. So I don't know if there are better words, but I do appreciate like trying to recommend that we fine tune that relationship a little bit so that MHO isn't feeling like there are some administrations where they're just locked out and some administrations where their input is welcomed and invited and received.
Just excellent way to put it. Thank you very much for capturing that.
My question is, is the sentence that says recognize and strengthen the role in working to streamline workflows, processes, contract procedures, and develop supportive policies? Just kind of how was, it just seems like it's several different things. Just wondering the history there. I hear what you're saying. I just kind of wonder how we got, that just seems so micro.
Specific.
Yeah, so specific, streamlining workflows, work processes and contract procedures.
Right.
So some of that's a distillation of what we saw in the comments. And we subsequently had a conversation with folks at MHO to, get some understanding around that. It also is somewhat representative of the policy memoranda over time that has kind of governed the quote-unquote role that MHO plays. So if it feels specific, it's because it's stuff that's been there in the past.
We could make this less specific, right? Which I think is in a different direction than the comment Nicole was making about making it perhaps a little bit even more specific, or at least describing how to operationalize it. But certainly a recommendation, if you have suggestions, we could, amend this to be less specific, and perhaps the narrative could describe some of the specific suggested actions. So definitely open to that. And I think if any of the commissioners have suggestions, this is the time to provide it, because we'll be voting on this. So if,
honestly, I think the first, it's a long sentence, but the first ending at messages. Because what you're saying to me, we're using this organization across all 24 to convene, collaborate, share goals, strengthen workforce, and promote advocate. So whether that might not be streamlining the workflow, or it could be. I think if you just take off recognize, you could go take off recognize and then come down to creating a public health policy roundtable or enhancing the public health. So the public health roundtable is an actual thing, right?
Right now there is a forum where the Deputy Secretary of Public Health Services at MDH convenes once a month the local health officers. That is called the Public Health Roundtable. At one point in time, I believe, and this predates me, and I've been here for about 13 years now, I believe that roundtable was intended to be a place where there was collective policy decision making. From my understanding, we departed from that practice, and it is now more of a communication forum. And providing updates and depending on the administration, there may be some, opportunity to provide comment on policy, but not always consistent. It is not a MHO organized. It is organized by the Deputy of Public Health Services at MDH. And I think it's. But many of those actions coming out of that, or that require some collective input, end up getting put on the MHO plate to then effect, right? To then gather or collectively decide or something to come back to MDH. So I think this is recognizing that MHO needs to be a part of these processes, because MHO ends up being utilized for that purpose anyways.
So if I were works with it, I think I would take from messages all the way down to enhance, and maybe change enhance to supporting the public health roundtable. That way it gives more opportunity, it's not as specific. You see what I did? It's just like.
Is it support MHO's involvement in the public health roundtable, or I guess I'm trying to get a little bit more clarity on that.
Supporting MHO's involvement in the, like you said, the public health roundtable, or either supporting the public health roundtable to align with MHO goals or something.
Yeah, that might be a little too much, but I'm just thinking of, the way the structure is now. I'm wondering if Dr. Crom, who's on the line, who, of course, when she was previously serving as Deputy Secretary of Public Health Services, she was convening the public health roundtable. If you have any thoughts you wanted to share, Dr. Crum, or if Ruth Rana from the executive director is on, they can certainly provide some insight, or she can certainly provide some insight into, I think, NACHO's current role.
Sure. Oh no, go ahead, Ruth.
Before you start, Elizabeth, I had recommended to the team that the round table and the MACHO piece, well, they should be separate, because roundtable is MDH's program for the health officers, and Mina is absolutely correct. MACHO does have work to do after the roundtable to help with some of the work, but it's the meeting for the MDH's Public Health Services Administration and other administrations to meet with the health officers. I'm there as in a supporting role for MACHO, but that it's not specific. So I just want to be careful that we're not conflating those two things.
That makes sense. I mean, I think I was going to make a similar comment, but I also I'm not fully aware of when MACHO meets just as a group. I mean, you might have your own policy roundtable and discussion, and you certainly, take positions and do other things. So there must be some subcommittee or full group that does that. So I think we need to make sure that we're optimizing the health officer roundtable. And I think there's been some improvement there in the past few months, so that it's more than just means for communicating changes, but there's a little more actual discussion and work done together. But it does seem separate from the MACHO work itself, linked, but separate.
So thank you, both of you. Appreciate that. Any additional thoughts from commissioners online? Okay. So the other thought here is maybe removing that last sentence because that might be right. If the public health roundtable is really more of an MDH, not conflating it with the MACHO related partnership. So this is a revised version of the first new proposed objective based on some of the discussion we've been having here now. If there is a motion, if there's no other additional kind of questions or discussion around this, then we could certainly take on a motion to consider this recommendation for a vote.
I move to consider the recommendation for vote. Next.
Okay. Anybody else?
Second.
Okay. Thank you. I don't know that we need to actually vote on this, but okay, thank you. Since we started the process.
Yeah.
Any other thoughts on that? Can we go ahead and move forward and vote on this recommendation? Okay. All in favor? Go ahead and signify by saying aye.
Aye.
Raising it. Aye. Thank you. All right. Any not comfortable with considering this recommendation further? Okay, great. All right, so let's go ahead and proceed with the vote. Sorry, any abstentions on considering this recommendation further? Okay, thank you. All right, we're gonna vote on this now formally. So this is the recommendation, and Shane, I'll pass it to you to conduct the voting process.
Delegate Bagmal,
Yes.
Mina,
Yes.
Jean,
Yes.
Senator Lamb,
Yes.
Boris,
Yes.
Tosin,
Yes.
Nicole, Michelle,
Yes.
Dr. Crum,
Yes.
Alan.
Yes.
It passes.
Great. Are there any other commissioners that were not called on who may have joined after we did roll call? Okay. All right. Thank you. All right. Thank you. So we'll move on to the next one. And I promise after this next one, we'll take a very short break. in this meeting.
Okay. Recommendation PCP 067, Community Advocacy and Professional Organizations. Under the strategic objective of utilize umbrella organizations, add recommendation to formalize partnerships with statewide nonprofit organizations by specifying the activities that align with the goals of improving Maryland's population health. Encourage engagement between the public health workforce and state public health associations to strengthen coalition building, professional development, and policy advocacy efforts. These associations provide valuable platforms for sharing evidence-based practices, aligning community health priorities, and supporting legislative action that improves population health. We will now have discussion.
Any comments from commissioners in the online? I'll start with you first. Sorry, if somebody could exit that.
So I just wanted to note that in addition, oh, I'm sorry, put it online.
Yeah, any commissioners on, it's okay, I don't think I read. Any commissioners online, if you could speak up or raise your hand. Okay, sorry.
Yeah, I just wanted to do a recall, especially for the communications and public engagement workgroup members that might be online or in the room. So this is one of the recommendations that we had looked at, in terms of, so it was just very interesting, the congruence for the public comment. We think, it's really, really important, community advocacy and professional organizations, working together with governmental public health, to advance the work. I think it's really, really important. So just wanted to note that.
Thank you. Okay. Any other thoughts? Okay.
Hi, I'm sorry. Hi, it's Nicole. I'm looking at one of the Rosalie's comment in the chat, and I just want to clarify the use of the word statewide. It does not exclude local organizations, correct?
I believe there are already other, is that correct? Other recommendations that refer to better partnerships between local health departments and so forth. I know there are strategic objectives that specifically call that out. I think the intent of this was to respond to some of the public commentary and also, the commentary gathered that essentially was encouraging that there be a greater partnership with entities like the State Public Health Association, like other associations that represent that are involved in public health at a statewide level.
Can I comment on that? If possible, so as not to maybe limit it to statewide, states and or national organizations, if people can choose to formalize partnership. But I think so it doesn't limit that statewide, because for example, take public health. Local departments can choose to, within the purviews of of how far they can partner with APHA. So that way, just looking at that statewide and going back to the comment, I think we may want to consider statewide or national nonprofits. That way, it just doesn't limit. And also that goes to other organizations, aside from nonprofits, right? So partnerships in general.
Yes, I think is that not addressed in some of the other recommendation language?
There's certainly the Public Health Advisory Board recommendation that kind of contemplates the folks outside of the nonprofit community being engaged in this. But the idea with the umbrella organization strategic objective was really kind of coalition building and recognizing that those for example, like MDPHA and the affiliates that are in the space but not always communicating together or coordinating, bringing kind of that voice together in a more unified way.
Right. Again, I think, with the addition, I think what would fix this is if you take out, under what, 1, 2, 3, 4, the fourth line, if you take out state from the public health, it opens it up, right? Nonprofit organizations, again, state, national, it allows, that's just my comment.
So are we making that edit then, or?
I mean, I made it so folks could see it, but we'll need a motion.
Any additional thoughts from commissioners online? Okay, all right. So is this what you're thinking, language as it is?
Yeah.
All right. So if anybody wants to make a motion, we can then consider this for voting. Okay, we have a motion to move forward with voting. Actually, I didn't really need to do that, but okay, go ahead.
Oh, second.
Right.
Oh, got a little thing going.
All right. Is everybody okay with this as for moving to a vote online? If you are, please say aye.
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 Thank you.
I'm
right.
sorry, Mina.
Sorry.
Dr. Bruce. And can you just read it? I'm driving, so I cannot see what has been put up.
Sure.
Sorry, who was that, Dr. Crum? Okay, all right. So the recommendation that we'll be voting on is to formalize partnerships with statewide or national nonprofit organizations by specifying the activities that align with goals of improving Maryland's population health. Encourage engagement in the public health workforce and public health associations to strengthen coalition building, professional development, and policy advocacy efforts. These associations provide valuable platforms for sharing evidence-based practices, aligning community health priorities, and supporting legislative action that improves population health.
Okay, that's great. Thank you.
Sure. All right, we'll move to a vote on this. So Shane's going to take it away. And the options are yes, no, abstain.
Correct. Thank you. Delegate Bagnall?
Yes.
Mina?
Yeah.
Jean?
Yes.
Senator Lamb?
Yes.
Boris?
Yes.
Joseph?
Yes.
Nicole?
Yes.
Michelle?
Yes.
Elizabeth?
Yes.
Alan?
Yes.
Passes with 10.
Great, thank you. Okay, thank you. We'll move to a break. Let's do a break and reconvene at 3:50, which is about 9 minutes from now, if that's all right. All right, thanks everyone. All right, welcome back, everyone. Thank you so much for sticking with us through the break. We'll go ahead and move in. We're in the process with the process of voting upon the new recommendations proposed as we came out of the public comment period. We'll go to number 3 of 6.
Okay. Recommendation PCP 068, Public Health and Healthcare Services Alignment. And this would fall under the strategic objective of align governmental public health activities and add the recommendation to create an agreed upon subset of health and healthcare outcome metrics and goals to facilitate public health and healthcare services alignment and innovation to jointly monitor progress. We'll now have discussion.
I think this reflects not just what was submitted as commentary during the public comment period, but also much of the discussion we've been having this entire process of this commission, really.
I like that one. Period. Yeah, I think there's been too long disconnect.
Any suggestions for revisions or amendments from commissioners online? How about commissioners in the room? Okay, hearing none, let's move to a vote.
Okay.
And Shane will do a roll call. And again, your response could be yes, no, or abstain. She's going to get on. Well, I don't know if she has yet.
Delegate Bagnall,
Yes.
Mina,
Yeah.
Jean,
Yes.
Senator Lamb,
Yes.
Boris,
Yes.
Joseph, Nicole,
Yes.
Michelle,
Yes.
Elizabeth,
Yes.
Alan.
Yes.
Passes with 9. Yeah.
Thank you. Okay, great. Thank you, everyone. We'll shift over to the 4th new recommendation.
PCP 069 MDH Roundtable, and this would fall under the strategic objective of streamline administrative operations to add the recommendation to utilize the existing Maryland Department of Health's roundtable meeting between Public Health Services Administration and local health officers to promote collaboration and coordination of public health program and service delivery at the local level. Fully realize the potential of the MDH Roundtable to maximize effective administration and clinical public health services, service planning and delivery, health monitoring, and policy development at the state and local level through enhanced collaboration and integration of local health officer experience and knowledge in the development of policy positions and policy making. We will now have discussion.
Any comments from commissioners online?
I think I'm just struggling a bit with, this sounds similar to the earlier one to me, and I'm sorry because I'm not looking at it, I'm just hearing it. But I also feel like this is what that group does now. So I'm just trying to understand what is very different and new about this recommendation.
I'll be honest, I have to agree. And I think a part of I think there are definitely opportunities to enhance the kind of the functionality of forum like MDH roundtable. You know, as was mentioned before, sometimes it depends on the administration of how functional that service is. I'd also like to note that, yes, that roundtable is organized by Public Health Services and typically emphasizes public health services, but the local health departments, just like MDH, are super agencies and really, you know, need the ability to have a form of communication with other administrative units within MDH, which I think was part of the rationale behind the recommendation of you know, having a more formalized liaisoning office at MDH that's at the secretary level. So I guess I'll put out there that I don't know that this is much different than what is currently happening, other than and I feel like it probably there's a gap to it in the sense that it doesn't really encompass the rest of MDH that really needs to be more actively engaged with local health officers and local health departments in a very meaningful way, not just in an invited guest kind of way. And what I will say is that this, you know, some of the utility of roundtable is dependent upon the administration of the time. And so, and as Dr. Crom mentioned, you know, there have been improvements in the past few months, but again, that somewhat is that can change during over a period of time as administrations at MDH changes.
Delegate Bagnall has their hand up.
Okay, Delegate Bagnall, thank you.
Thank you very much. Yeah, this one also gives me pause, because it does feel redundant, and also it's something that we're already operationalizing. The reason it gives me pause is because we do have so many recommendations that I don't think we want anything on that list of recommendations if we don't feel like it is progressing public health.
Any other comments from commissioners online? Okay, comments from commissioners in the room? Or questions, or?
I feel like the same, it seems duplicative.
All right. Let's go ahead, unless the staff have any, the support team have any thoughts on how this may have evolved from the public comments and so forth, or if there was a different intent.
I don't think there's anything really to add except Ruth says something. We no longer have a roundtable focused recommendation. It was taken out of the MHA.
Sorry, any thoughts?
Yeah, so it was, I think also reflective of some historical documents that kind of helped chart the contours of what roundtable was earlier intended to be, and maybe around the idea of formalizing or inculcating that. But I think Delegate Bagnall makes a really great point that with the volume of what we have, we need to make sure that we're being impactful.
Okay. All right. This is proposed, so let's move to a vote. And Shane, if you could take that forward, that'd be great.
Okay. Delegate Bagnall.
I vote not to advance.
Mina?
No.
Jean?
No.
Senator Lamb?
No.
Boris?
No.
Tosin?
Advance.
Nicole,
No.
Michelle,
No, can I just add that I wish there was more discussion from those who proposed it to have a better understanding of what they were thinking, but my vote is no. Thank you.
Elizabeth, Dr. Crum, are you there still? Alan,
Yes, I am. I'm sorry. No.
Alan,
No.
all right, 9-1. Does not pass.
All right, moving on to the fifth recommendation that's proposed.
Those lines appeared. PCP 070, Enhanced Procurement and Contracting Systems. Under the strategic objective of review existing funding mechanisms, invest in better systems to enhance procurement and contracting efficiencies among Maryland Department of Health and local health departments, hire dedicated personnel and procurement personnel to streamline processes, reduce delays, acquire resources efficiently, and monitor expenditures to support critical public health programs. We will now have discussion.
Okay, thank you. Any comments from commissioners in the room? And just to clarify for everyone's benefit, procurement at MDH is of course handled through the state. Procurement at each LHD is either following a local process or the state process. LHDs have that option to follow the local procurement process. And so they may not be on the same, if MDH has a particular system in place, they may not be utilizing that system at the local level.
This is Tosin. I have a, oh, this is time for comment, sorry.
Yeah, if you have any suggestions, revisions, amendments, or questions on it.
No,
Yes,
I don't.
I would just suggest that we expand the systems, what systems mean. Yeah, thanks.
Sorry, could you,
Is it
I don't know.
electronic health system, or, what system are we talking about? Hire dedicated staffing, that works, because it's talking about, streamlining process, hiring. You can see what the personnel will do, but invest in better systems. Is that the overarching goal that covers the hiring, or are you talking about a particular system?
That's helpful. Thank you, Tosin. So the
You're
question then, was this intended to the support team that crafted this from the public comments? Was this intended to talk about a management system, a technology management system, or is this about the procedures or overall process?
Correct. Yeah.
Yeah, it kind of straddles both. So there is a piece of, to some extent, what we heard from site visits and in the public comment portion related to procurement is that, to Mina's point, it is dependent on the county and jurisdiction. And so it may be more manual than not in certain cases. And so to the extent that there's maybe a consistent platform that enables those configuration to local requirements that might be able to still create an electronic or digital process, that's certainly one option. But I think the biggest piece, and in particular, what we heard from folks about during the organizational surveys is most local health departments have maybe just a couple people who are actually helping specifically on procurement related tasks, even though that is such a significant portion of what local health departments do in terms of making grants, issuing contracts, and so forth. And so it seemed like it was a real low area of or a low bench of expertise.
Yeah.
So,
Okay.
just more points of failure potentially.
That helps. Tosin, does that address your question or do you?
Yes, yes. So it appears to be more overarching, just generally the systems, and that would vary per organization. All right, thanks.
Okay, if any other comments or questions or amendments?
Yes,
Commissioner?
this is Nicole. I was scanning the current document and it looks like there is some redundancy with what is this one? DIT 049, which talks about implementing streamlined technology platform to improve the efficiency of health department business functions, and it mentions procurement. So I just wanted to, do we feel like this needs to be separate? Or, I mean, I don't know that that one addresses, or I don't think that one addresses the workforce. So it seems like this one kind of combines the technology and workforce. So I just wonder if we may want to, if we're going to adopt this one, we may want to consider revising or removing some of the other ones that address this same issue. And I don't have the capacity to like go through all of it. I know there's one, but there may be others that also address this issue.
Thanks for picking up on that. I think just in response to that, I agree. I mean, I remember the specific one you're talking about. That was from the DIT group. I think that one does specifically focus on the technology platform to support processes, and this one seems to be broader, although inclusive of technology. So maybe I do, and for my opinion, I do think this is different enough, particularly because of its emphasis on workforce and that it's a whole objective, or sorry, a whole recommendation specifically focused on procurement, which is such a big deal, and really honestly was included or explicitly called out in the legislation because of it being such a big deal. So I think this was an attempt to really more concretely address that big deal of procurement. But I'm wondering, to respond to the questions that have been raised or the comments that have been raised, maybe we need to clarify the word systems, and instead of saying the word systems, because to some it could mean electronic technology, like in the other recommendation. To some it can be processes and procedures. Maybe for us to just say invest in better technology, processes, procedures, whatever, or a collection of those words to enhance procurement and contracting efficiencies among MDH and LHD. So we are clear that this is more inclusive, but also does include technology. And there may be an opportunity in the narrative to cross-reference the other recommendation that is more technology specific. Would that address?
Oh, I'm sorry. Thank you. As always, Mina, your explanations bring me over to your side every time.
Thank you. Thank you. And Tosin agrees with that too. Are there any concerns about making that enhancement to the recommendation? So invest in better, let's say, processes and technology systems.
I just, one comment with this is, there's obviously the procurement piece, but the monitor expenditures side of things, that's different from procurement.
Yes, the contract monitoring and the budget monitoring is separate from procurement. That's a great point. Now, the first sentence does say procurement and contracting efficiencies. So, Dr. Karma, are you recommending that we maybe add another and say enhanced procurement and contract monitoring?
Yeah, I'm not entirely sure, because there are various different systems, and there's actually a fair amount that's already been done to improve some of these things on the procurement side. So I'm not sure what the right wording is here to make it comprehensive.
Just because of the way I'm re-looking at this language, I would recommend in response to that, I think you're right that contract monitoring is its own piece and it should be called out more explicitly. I would suggest we could include that in that first sentence.
Yeah, I was just going to add for some context there, the monitoring being to a certain extent, if you have a contract with assigned scope of work and a certain pot of money attached to it, how that's drawn down, or grants similarly. So I think to lose that altogether would maybe shortchange the overall goal, but if we can, if the idea is to condense it a little bit, that would work.
Well, I was actually thinking of adding it. So like enhanced procurement, comma, contracting efficiencies, comma, and contract monitoring amongst MDH and LHDs. And of course, our narrative could certainly recognize, and we've had that discussion with MDH, there's a lot happening at MDH that's already in place. But again, as I mentioned, procurement, contract monitoring, that whole process may be different at local levels. And so and this recommendation would apply to both state and local levels. With that, Dr. Crom, does that address, do you think with the changed language, do you think it's more inclusive?
I definitely think it's more inclusive. I do worry a little bit about what's in the locus of our control with some of the, procurement policies are, from the state side, it isn't just necessarily MDH determining that some of that is outside of our agency. But yes, I think the language itself is more inclusive.
Thank you. Any other comments from commissioners online or in the room or suggestions on this recommendation before we vote on it? All right, hearing none, let's move to a vote.
Do you want to motion to amend?
Do we need to? I'm just curious. Okay, I think I did it before, but yeah, sure. We can do it. If there's a motion to amend or vote on this amended version, we could do that. Or if you're ready to, we could bypass that and just move to a vote on this.
We can just move to a vote in the interest of time. Thank you.
Great.
All right. Let's go ahead.
Delegate Bagnall?
Yes.
Mina?
Yes.
Jean stepped away. Senator Lamb?
Yes.
Boris?
Yes.
Tosin?
Yes.
Nicole?
Yes.
Michelle?
Yes.
Elizabeth?
Yes.
Alan?
Yes.
Passes with 9.
Great, thank you. I did notice, sorry, I think it's contract monitoring, not just monitoring, but I don't know if that's explained by the language we have here. Sorry, we just noticed we didn't have the word contracting in there in front of monitoring. I think that's what we had discussed and was intent, but if this changes anybody's votes, could you speak up now? Okay, thank you. Hearing no changes, we'll move to the last one, please. Thank you.
Okay. This is a bit of a long one. PCP 071 Medicaid Reimbursement Task Force. And under the strategic objective of explore new funding models, establish a Medicaid reimbursement task force to be convened by MHO. The task force will have representatives from MDH healthcare financing / Medicaid, public health administration, local health officers, local health department billing professionals, and Maryland Association of Counties. The task force is charged with collaboratively working on the following issues in addition to other items that are determined by a majority vote to be germane. A written report of progress and potential legislative fixes will be submitted annually to the chairs of the Maryland General Assembly House of Health, House Health and Government Operations and Senate Finance Committees. The topics under consideration would be studying ways to streamline and simplify local health department contracting processes for insurance carriers and governmental, including master agreement negotiation, issuing normative guidance or adopting legislation requiring carriers to enroll and credential local health departments, and making recommendations to the Maryland General Assembly and Maryland Department of Health Secretary. Studying the feasibility of restructuring Medicaid reimbursement rates for local health departments that is in a way analogous to federally qualified health center reimbursement to better reflect the payer mix of public health agencies' costs of services provided and account for complex population needs, and explore ways that local health departments can share in cost savings that produce measurable reductions in Medicaid expenditures as a direct result of successful public health programs. For example, reducing neonatal intensive care unit costs to Medicaid as a result of improved outcomes for high-risk pregnancies. A quick point of order, if this sounds very familiar, it's because it is an amalgamation of several recommendations from the funding work group previously that were originally approved by the commission and sent to the slate based on conversations with folks at the Maryland Department of Health, as well as a few other organizations. The suggestion was that the complexity behind some of those recommendations really needs to be worked out a bit more. And that while the underlying intent is not a bad goal or something that is opposed by any of the parties in play, adopting the recommendations as they were would have put them in a place of being difficult to implement. So this was an attempt to bring the spirit and goal of those recommendations together in a way that keeps the work going and formalizes the ongoing conversation of it without necessarily tossing out all of the work and findings of the funding work group, recognizing that considerable effort did go into that. So that was the underlying context that I wanted to provide to that before we went into discussion.
That was very helpful context, Shane. Thank you. So with the understanding that this may be replacing some of the recommendations that we had previously agreed to move to the public comment period, and then those recommendations that this might potentially replace, we would need to vote on removing or canceling, I should say, at the September 11th meeting, if this one moves. Is that right? To prevent duplication, essentially. Okay, thank you. All right. Commissioners online, any comments or suggestions for change before we move, before we vote?
Nicole again. Hi. Is there a way to this? I mean, as Shane, said in the prelude, this is very, very long, and I certainly don't want to edit it in a way that eliminates important information. But is there any way to kind of summarize this? And it just seems, not only is it long, but it seems very prescriptive, and I'm sure there's a reason for that. So I'm just putting it out there. Like, is there a thought that this could be slightly less prescriptive and more consolidated, or do these 3 bullet points really need to be there in addition to the narrative at the top?
If I recall, thank you, Nicole. As usual, you point out very astutely something for us to consider here. If I recall, I believe each of the bullet points related to a specific recommendation that received a lot of commentary during the public comment period, and that we've had. And so I think the attempt here, while it's generating a long recommendation, each of the bullet points is relevant to the top paragraph, and so it made sense to consolidate it into one. And that those each, we could potentially, if we were trying to save space, make these 3 recommendations, repeat the first paragraph and have a bullet point underneath each of them, or somehow, put it forward that way. But again, I think this was attempting to consolidate at least 3 other recommendations into one that were, attributable to the same type of study group. Delegate Bagnall.
Thank you. Thank you for that clarification. And I had a similar question in that, is this recommendation to create a task force or like a standing committee that continually reviews these, or are these the charge of a time limited task force to look at these 3 bullet points?
Like question. I don't know the answer to that.
I don't have the answer, but no, I don't have a suggestion, but I think, and Delegate Bagnall might echo this too, that like, this is obviously very prescriptive, as everyone's noted. It almost is like bill language, like that we would just include in a bill, right? And with, a task force being set up, specific things being looked at, specific stakeholders being included. It's almost like you could just package this into a bill.
Is that a good thing?
Which isn't necessarily a bad thing in a recommendation. that makes it very actionable. So
I do recall some of the workforce work group recommendations being lengthier and with some language that would be helpful if there was elected officials looking for specific language.
And the reason that I posed that question is because task force does indicate a time limited organization that is charged with a specific task under a specific timeline. So I was just trying to clarify if this was an attempt to create a standing group or a very specific group with a specific timeline. So thank you.
Yeah, and you raise an excellent point.
We really didn't get into the longevity as much as addressing the immediate issues that were brought forward by the funding work group, but also acknowledging that there's so many things at play within the Healthcare Financing Administration that, without some further conversation there, it felt like we were not being mindful of some of those nuances. And so this group would be able to continue after the work of the commission to be able to sort through those. So whether it's something ongoing or time limited, I think that there's flexibility there, but that was kind of the idea.
So, I'm not a fan of meetings without a purpose, but as a local health department that does quite a bit of clinical services or is involved with Medicaid quite a bit and billing and as well as with other insurance carriers. I would suggest that we continually have challenges in this realm, and it would be worthwhile for the state when looking at the sustainability of public health and the, really demonstrating the value of public health to our economy, that we have ongoing study of these issues and ongoing work to resolve issues identified in the realm of Medicaid reimbursement and local health department billing. So in short, I would recommend this to be an ongoing entity. So if task force, which is time limited, is not that, then if the commissioners agree, I would suggest we change that to whatever is a standing entity. And perhaps Delegate Bagnall or Senator Lamb can provide some guidance on that.
I get the thought being having a task force being a standing entity, or
is there another word that you would recommend if we were going for longevity, or if people feel like a short-term task force for these purposes is where we start, then maybe that's what we recommend and vote upon as commissioners.
At that point, it does contemplate a report to the legislature, so if they determined longer time was needed.
Good point.
That could.
Yeah, I mean, partially just semantics. I mean, whether it's a task force or work group or something like that, yes, it would be time limited, but we could extend the time, just like for this commission, we actually extended the time. But, you know, this commission is also time limited. So, you know, you could call that a commission, I guess, as well. But,
right.
You know, so just kind of a semantic point. But, you know, it is frequent that we, you know, start things, whether you call it task force, work groups, committees, commissions, for a time limited basis, and we may extend it.
Mm-hmm.
Or we change the scope of the work based on the work that has preceded it. I think I will just say I think task force is fine. As you said, there is that submitting an annual report. I think a task force makes it clear that these are the 3 priorities, and then, you know, additional priorities as needed and additional work as needed.
Great, thank you. So if and it does say in addition to other items that are determined by a majority vote to be germane. So I think that addresses what you just said, Elliot. Okay, all right. Thank you. Great points and discussion. Any other points from commissioners online or in the room? Hearing no one speak up, let's move to a vote with Shane steering for us, please.
Delegate Bagnall?
Yes.
Mina?
Yes, resounding yes.
Jean?
Yes.
Senator Lamb?
Yes.
Boris?
Yes.
Tosin?
Yes.
Nicole?
Yes.
Michelle?
Yes.
Elizabeth?
Abstain.
Alan?
Yes.
Carries with 9.
Okay, thank you. All right, thank you, everyone. We have moved through those 6 proposed new recommendations. Is that right? We got through all 6 of them?
We did.
All right, thank you, Shane, for steering us through that. Now we're going to wrap up the meeting with some comments. Hopefully, each of you have had a chance to think about and to deliberate upon the questions that Shane had put forward in the email before the meeting. You know, just to kind of kick us off, you know, we have a little over 1 month left. We've gone through a public commentary period with some pretty meaningful discussion to explore those comments that we've had with, you know, meaningful discussions we've had with different organizations who provided comments and so forth. You have a draft now of the updated recommendations that we will consider during the September 11th meeting. We've moved through some proposed new recommendations, and you also have an opportunity that we've outlined to provide dissenting comments on any of these recommendations for inclusion in the final report. So previously, our group had voiced a desire for bringing together some cohesiveness of the recommendations and prioritizing in a way. This really led our support team and our academic partners to work very hard to generate some of these cross-cutting recommendations as well as themes that Shane and Sarah had presented before, and as well as the strategic objectives that are categorized underneath themes. So the themes and strategic objectives really bring together the recommendations, attempt to provide that cohesiveness, and attempt to also describe some big priorities that we need to consider as we look at making the system in Maryland a leading system. Really, if you could provide some comments, feel free to reflect upon if you have any thoughts, additional thoughts on what Jean had raised earlier about language in the report and how that language may or may not align with some pivoting of language nationally, or how it may or may not align with Maryland's preferred language. Also, is there anything else you hope to see in the implementation process following the report? And generally, how close is this to your outlook on Maryland's ideal public health capabilities? So a lot there, but hopefully there are some comments. And if I could take, you mind if I borrow actually I have it right here. If it's okay, I'll run through and just call on each of you. If you don't have any comments, that's fine too, but we definitely wanted to give you a chance to provide a few words before we close out the meeting. So is there anybody who wants to, any of the commissioners online or in person who want to go first? If not, I'll just go ahead and start calling people who are part of our meeting.
I'll jump out there.
Thank you.
So I now in looking at the different recommendations that we have, right? The last one was Medicaid. We're talking about finance. We're talking about community partners. We're talking, just the themes of the last recommendations. I'm just a fan of beginning with the end in mind. We want this to move forward. We all know that we are in a very different environment. I think that we would be remiss if we did not strongly consider the narrative, the words. Words matter. Words matter. It is what it is. And I just think just kind of being where I know I was a year ago, with just health equity, I just, that's not, it's going to fall on deaf ears. Well, I'm not going to say it's going to fall on deaf ears. We need money to get these things done. And I don't think it's abrogating our mission when we just, I think it's being smart to figure out how do we now serve our communities and figure out a different way. I mean, that's what I think they want us to do is to, you got to pivot because we can't, we still need food, but you all can. And if the dollar needs to be called something different, let's call it that so we can get that food or that transportation. So I just feel like we need to do that. I'm not saying totally, I don't want to, wash everything out, but I do think we need to temper or modify smartly, pivot would work.
Yeah, thank you. Thank you. Okay. Boris, if you're on still, oh, sorry, Delegate Bagnall, I see your hand. Go ahead, you go.
Thank you. I appreciate those comments, and I appreciate the sentiment, and I share that sentiment and those concerns. I am also on a national public health cohort, and hearing what is happening in other states is deeply alarming. Maryland has done a lot of good things to protect ourselves and give ourselves time to figure things out, but that time is not without its limits. What I will say is that Maryland, we are not going to put forward anything that is going to put a target on our public health system. These recommendations aren't being presented to the federal government. They're being presented to the Maryland legislature. And so I think maybe rather than trying to catch up with an ever evolving landscape, one, making those recommendations directly to the Department of Health on any insights you have on language, but also maybe there is another recommendation or in the narrative that we recognize that although we are, though we continue to be data driven and evidence based, which I think are the core values from which we lead, that we do recognize that language is evolving and that we need to evolve with it. And that may get us into that space where we're not having to try and go back and re-edit all of the language. We could literally do, a find and replace, but we don't know 2 weeks from now what the next trigger word that we're going to have to find and replace is. So maybe couching it in that narrative space, that we need to, we need to be flexible with that language and understand that, to your point, that we have a federal government with a certain point of view that isn't always aligned with public health, but that these recommendations ultimately are going to the General Assembly, and we are very receptive to adapting as needed to ensure that we're protecting Marylanders and our population health space. I don't know if that helps or not, but maybe that can just be a consideration for how we sort of thread that needle.
Really appreciate those comments. Thank you. Dr. Crum.
One, I agree with what the delegate just said. I think those are really good points. The other thing there was so much work put into this, right? And no one knew at the time what the changes were going to come with the election or what we're facing in terms of our state budget or anything else. So I want to make sure that we're appropriately honoring all of the work and the strong recommendations that went into this, but also just being realistic and practical, that starting new groups, funding new positions, doing things where we literally don't have the ability to do that. This is hard. And if we need to figure out how to deal with how to implement work requirements and HB1 and everything else, we might not be able to then do other things that are on this list right now. We might have to deprioritize that work because we have to focus on some of these other things due to other changes happening at the federal level. That doesn't mean that it's not important work, but in my mind, I'm thinking how we're going to, as a department, operationalize and make sure that we're prioritizing this good work. We're also acknowledging all of the effort that went into it and the overall themes that I think everyone can really agree with. But with the sort of clear realities of, in our limited time and staffing, we have some really significant challenges that we have to work through in response to stuff that's happening at the federal level. So I don't want to lose this, and I don't want this stuff to get lost, but I am concerned about, in focusing on dealing with the more recent changes, it might appear that we're not prioritizing this work, and we very much want to. So that finding that balance, I think, is going to be really important for the department, and talking that through and being transparent with this commission and with the legislators is going to be as well.
Thank you.
Can I jump in, Mina?
Please go ahead. Thank you.
Just echoing also what Elizabeth just noted, and recognizing that the legislative session will start after these recommendations are being presented, and just thinking about the Office of Minority Health and Health Disparities and all of the other individuals that came and presented to us when we first began this process. The AHEAD model as the way of us thinking about equity in our state, and certainly what's happening with Medicare. And so there's so much just thinking about all that Shane and Sarah and the team has done in supporting this and moving this work forward, and yet taking a look back of over the last year and all that we've been engaged with, and the individuals that came and spoke to us about what are the potential opportunities, and we find ourselves in this moment where things have shifted. And so I do agree that language is certainly important, but I also know that this is a moment for us to think about how Maryland continues to be a leader in this space, and how do we lead with continuing with integrity and continuing with the thought of public health and population health at the forefront of the things that we're doing. And so just want to be mindful of our commitment to advocacy and science and whole person, and certainly public health, and just thank everyone for their commitment. And I would also just note that there's so many recommendations that we are putting forward, and thinking about our urban areas as well as our rural communities, and having that in mind, and as well as the resources that were lifted in terms of how we do this work and how we're able to move the work forward. And so just noting that those are the opportunities that were presented before us, and the way that we've thought about how we can move forward given the diversity of our state, be it rural, be it urban, be it suburban, and thinking about how we can do this given the current structure and the current administration.
Appreciate that. Thank you.
So, sure. So let me, I guess, present a different angle as well. I think, we don't do this very often, right? We have not had a commission on public health, probably in recent memory, long memory, right? And so, I think we're obviously in a period of a lot of upheaval and uncertainty, kind of given the federal environment, particularly when it comes to public health. But I think I would caution us to not hold back when it comes to the recommendations that we have here, and whether it's language or what we think ideally should be done as a blueprint or as a roadmap for future public health here in the state, not just for the next 1,200 or so days, which are ultimately very chaotic, but also beyond, for the next 5 years, 10 years. I have a countdown on my phone, so you know how many days are. And so, I think there's a real opportunity here to really look at the long term, since we don't do this very often, if at all. That if we, really kind of downscope ourselves to the immediate needs or the next few years, that we're missing an opportunity here to really shape public health for the future for many, many years to come. And so, I think for us to think big and not limit ourselves, we'll be limited when this report hits the General Assembly. We know as legislators that we're going to be pulled in a lot of different directions with the budget, with what the department conveys back to us, what the current environment will be in. And so there will already be a rate limiting step. And so to this commission, I think, I would be hesitant to limit yourself, knowing that this is a document that might and would hopefully have some longevity to it, that maybe somebody 4 years or 5 years down the line can still pull off the shelf and look at it and say, oh, we've done this, this, and this, but there's still other fruit that we haven't picked that still could be done later on. Just to kind of keep that in mind when you're working through this. But otherwise, I think a lot of effort's been put into it. Certainly appreciate all the staff time, all the members' time, the commissioners' time to help bring this together, and hopefully will serve as a good long-term roadmap for work that needs to be looked at, taken on, and implemented by the legislature and by the state.
Thank you.
Can I just add one thing that Senator Lamb's comment made me think of? What I really appreciate about that is, this idea of sequencing things, and knowing that on October 1st, it doesn't mean that on October 2nd, we're trying to implement every single recommendation right away. And I want to acknowledge that, we had a really great conversation with Secretary Seshamani about that, and understanding that NDH is pulled in so many directions at the moment, and that, it does have to be this sort of, spinning plates, and how do we keep these things afloat. And so, to the extent that we allow this document to evolve and be responsive to that, I think it speaks to how valuable it'll be down the road, whether it's 3, 4, 5 years and so forth. And so it is really thinking through how we take whatever is happening at the moment and respond using the recommendations and strategic objectives. So I think it's great.
Okay. Any of the other commissioners online?
Tosin has her.
Tosin, thank you.
You're muted.
Oh, you're muted, Tosin.
Guys hear me now?
Yep.
Yes, okay. I said it's almost as though Senator Lamb took words out of my mouth. I share the same sentiments. I also agree with so many of the things that have been said in terms of just acknowledging the hard work that has gone into this process. You know, while we want to temper the language, the main things that come to mind, you know, in terms of how we want to approach this 5 to 10 years to come is we have to be the gatekeepers of public health. You know, I know there's so much fear, you know, based on what's going on in the administration, but we cannot work in fear. We have to be true to public health. So, you know, being true to public health, being the gatekeepers, especially because think about it, there might be another administration, you know, of course, another administration years down the line that, who knows, might change the language to favor public health. So then what happens then? Again, you know, at that time, then this document, they can always refer to it. It still stays true to its work. So I want us to think about that as we put forward this final recommendation. Thanks. The final report, yeah. Thanks.
Alan, did you have any thoughts? You may be muted.
Oh, no. Can you hear me?
Okay. Yeah, we can hear you.
Yeah, I'm sorry. This has been a very good discussion. And I think that it's really important that, you know, our commitment really needs to be being responsive to our community voices, and that we're using language that really aligns with best practices, and that we define, you know, terms as clearly as possible. You know, and sometimes I think that we make it overly complex or use maybe you know, not buzzwords, but maybe words that aren't easily understood too. So I think as much as possible, you know, using language that really reflects fairness, justice, you know, the removal of barriers to health. Because at the end of the day, it's not about the politics of the moment, but it's about ensuring that our language really reflects our mission. And that is to make sure that every person has a fair shot at good health. So those are just my thoughts.
Great ones. Thank you. Thank you very much. Nicole?
Yeah, I agree with everything that's been said. It's kind of hard to formulate like how do I feel about this process. It's been like nothing else that I've been involved in, and I just like to again want to commend everyone for the hard work. I remember when we first started, and I forgot what the initial timeline was, but it would have passed a long time ago, and then it got extended, and this just the commitment of everyone has just been really inspiring. I think that this slate of recommendations is very comprehensive, and like others have said, it truly represents the best of the best. And I think that, acknowledging realistically that it's going to take a long time for many of these to be implemented, and understanding that, this isn't a short-term process, but to the extent that we have the opportunity to be a model, which I do believe we will. I think this is going to be an enduring document, and we were advised at the beginning to be aspirational, and I think that we have definitely risen to that challenge. So I'm really proud of the work that we have done. I do have concerns that align with what's already been expressed, just in terms of the number and the breadth and the depth of the recommendations. And I know that there had been previous conversation, I think in the meeting I missed last month, about prioritization. And my understanding of the minutes was there were some concerns about prioritization. But I did want to just lift that up again as a possible way to, and I know, when you say these 5 or these 10, then the ones that aren't prioritized, there's a concern that they don't, that they aren't valued. But I just wonder if there may be some opportunity to really highlight a small section of these that we really, really, really feel like, there's either it's low hanging fruit or there's a huge impact to our communities. And then the last thing I'll say on a personal note is, as a pediatrician who is no longer practicing medicine and became an entrepreneur, and I do a lot of advocacy and a lot of other things. So if I ever thought about another degree, I thought maybe an MBA, but honestly, like after this experience, I am strongly considering a master's in public health because of this work and because of all of you. So thank you. This has been awesome.
Thank you. And I know several great schools that would welcome you. So please don't hesitate to pursue that. And I know several health departments and partners in public health who would welcome your insight and your expertise and your enthusiasm. Thank you.
Thank you.
Boris.
Yeah, I purposely allowed others, I can talk a whole lot, as you all know. I sometimes worry that I kind of have conflict of interest in this, because those of you who understand the workings of the commission understand that we have these monthly meetings, and yes, the commissioners are given assignments and things to look at, and then we gather. For me, and the other co-chairs will probably acknowledge this whole experience has been a second full-time job to a large extent. I am blessed by having a great staff and a great team at the University of Maryland School of Public Health. So Nicole, consider us, become a Terp, go fear the turtle, go Terps, et cetera, et cetera. But that being said, is the reason I say I have conflict of interest is so much of our discussions take place behind the scenes, right? So a lot of what you see as commissioners already is something that's been always sort of circulating in my mind. We've had some discussions, we've been setting things up, not assuming that you're going to agree with things that we've already agreed to. And I love this feedback of today's meeting in particular, right? There are great discussions, and you commissioners are a talented bunch of individuals, right? Everybody, as Nicole sort of stated, you all come from a different background, right? You come from we're all sort of completing a circle of activity here. So my reflections on these 3 questions is yes, yes, and yes, right? I mean, because I've been so embedded in this, I just need to make sure that we all understand what we've done. One is, and we'll have time again to celebrate it, there's still work to be done. I keep reminding people the final report is going to take all of our efforts to look at this and to be able to feel that we are doing the right thing. But first and foremost, I think this is going to be a landmark report, right? A landmark report in terms of both the process that's been conducted, and once again, nothing's perfect. Don't forget, you were all volunteers. Our working groups were all volunteers, right? People were brought in to do this because they had a passion for this or they wanted to serve their state. This is a way of doing it. But ultimately, we also have to be easy on ourselves. And ultimately, easy on ourselves is at some stage, our frustration can't begin now saying that the load is too much to bear, right? What we've come up with are recommendations. Are there a lot of them? Yeah, that's because we've been blessed with working groups that really took the big, deep dive, and we're hopefully not neglecting much, if anything. And I know the way the report is being focused is where we didn't have enough time, right? We are acknowledging that there are areas not fully covered by us, but guess what? We're there and we feel comfortable with where we're at. So thank you, Mina, for allowing me to speak a little bit, but that's kind of how I feel where we're at right now. Over.
Excellent, and just really appreciate all of you for taking a few moments and providing your thoughts. Does any commissioner, hopefully I didn't skip anybody, but if I did, please speak up, and I apologize for skipping you. Okay, great. Thank you. All right. Well, I just, again, really appreciate all of you for providing your thoughts and expertise and just really, wonderful insights throughout this entire process. It's been a tremendous journey, and I feel so very grateful and proud of everyone who's been involved in the process, including all the work group members, the commissioners, the support team, the academic partners who've assisted us, all the CDC Foundation, the Belmont Foundation, so many others who really work to support the efforts of this commission. And just I hope our final report relays that gratitude and just the reflects the extensive expertise that was involved in this process, and I believe it will. So thank you. We're going to, just for announcements, we have our next meeting is September 11th. It's virtual only, and that's from 2 to 5 p.m. Again, that will be a heavy hitter. We really need everybody's participation because we must have quorum to vote and approve on these whatever final recommendations we choose to move forward to the final report. And the last meeting that we have formally organized at this point is September 25th. We really, really would love for your in-person presence, if possible, at that. That will be in Annapolis, and it will involve adoption of the final report so that our support team can then finalize it out and submit it as required by October 1st. So we will need quorum for that and your pre-work, so to speak, and reviewing and whatever drafts have been shared with you. So thank you. Not too much further to go, at least in this part of the process. And if anybody wants to adjourn the meeting, I'd happily take a motion for that. Don't all jump at once.
We don't want to go.
Thank you.
I
have a first and a second. Okay, great. Thank you. Jean has been the reliable seconder this meeting. And I'll please say aye if you agree to adjourn the meeting.
Aye.
Bye.
Aye.
I think we heard enough ayes. All right. Thank you. So meeting adjourned. Thank you so much for all your time, everyone. We'll see you September 11th.